Hello everyone, welcome to this video. So today I'm going to discuss some tips to start an OET role play. In OET speaking, you'll have to complete 2 role plays, and for each role play, you get to prepare for 2 to 3 minutes. You must give a good start. So what's the best possible way to begin the conversation on test day? First thing, how to start the OET speaking role play. Before we take a look at the best way we can begin each of your role play, we need to take a look at the scoring criterion. Keeping in mind that you are actually scored on how well you start the conversation on test day. So you are evaluated in 2 ways. First one, language skills. Second is on your clinical communication skills. Let's have a closer look. So spoken language skills include fluency, appropriateness, grammar, vocabulary, and clarity. So these are the spoken language skills. If you want to maximize your scores, you must work on these things and improve your skills. You can avail our OET offline course as well as online course to study these in detail. And you are also scored on your clinical communication skills, which consist of relationship building, understanding and incorporating patient's point of view, providing structure, information gathering, and information giving. Each of these skills also have some sub-criteria. So what happens when your examiner is listening to your audio recordings of your role play and he is cross-referencing at these for your skills as criterion, and also he is evaluating for giving score for each of them. That's how you are scored. Let's take a look at the first clinical skills, relationship building. This is the skill that scores how you begin the role play. So for relationship building, the first thing is how you begin the role play. Second thing, your attentiveness. The third thing, how respectful and how non-judgmental you are. Also, how you show the empathy throughout the role play, means your tone, the use of the language. So, as you can clearly understand, these skills are not purely language skills, but more than that. It is about how you interact with the patient on test day in a clinical setting. There are different types of settings you can be given in the examination. So, here I would suggest you to polish your skills to improve in this subtest. You really must obtain Super 50 online OET course if you want to learn and improve your speaking skills. Next is relationship building. For relationship building, you need to focus even more on how to start the conversation. Basically, it is initiating the interaction properly, appropriately. In other words, how will you begin the conversation? Therefore, to maximize your scores here, you need to follow some steps. A, B, C, D. So A is greet the patient. So clarify the patient name if it needs to be. Introduce yourself. Clarify your role in their care. Explain the nature of the interview if it is necessary. In order to maximize your scores in these skills, we need to have a look over a role play card. So here I'm going to discuss a nursing role play card. You can see the role play card on the screen. So read this setting carefully. Scenario and your task. These 3 things are really important before you begin your role play. So you can see a role play card for nursing in front of you on the screen. Here the setting is rural community health clinic. You are the nurse. And in this, the patient is 79-year-old woman. So, for every different role play, you need to have a different beginning. So here, if like we have read, the setting is rural community health clinic, and the scenario, which is that you are talking to an old woman who is 79 years old. What I mean to say is that when you're speaking to a 79-year-old patient, and when you are talking to a teenager, the language is going to change. And the way how you initiate the conversation is also changed. For example, hi Maria, how are you? So this is really an inappropriate introduction. You're speaking to 79-year-old patient. This does not make sense. Hello Miss Maria, how are you doing? So this makes sense. Therefore, two things that I would like to advise you is, don't make the introduction too long. It needs to be efficient, like 3-4 sentences, and sometimes 3-4 sentences. So now let's have a look. So now let's have a look over this role play, and let's have a look over the task also. The first task is be sympathetic and understanding of her problems. Second, ask if there are any other things that are. So let's have a look over the scenario. A 79-year-old woman who lives in your community has come to see you. You have known her and her son for several years and are concerned by how she appears to have aged recently and seems agitated. You also know that the people her son arranged to help her are completely trustworthy. You want her to agree, let you contact her son as soon as possible to explain her situation to him. Okay, so here a 79-year-old woman is here who lives in your community. You have already known to her for several years and her son also. Okay, so it's a known case. And the patient is very aged and she's agitated also, and her son has arranged some people for her help, for her house help maybe, and they're trustworthy, you know already, and she's having some problems with them, and you want her to agree so that you need to convince her to contact her son so that you can explain his mother's situation to him. You need to convince her. Great. So the task is, be sympathetic and understanding of her problems. You need to be very sympathetic and you need to understand her problems very well, listen to her very well, and you need to ask if there are any other things that are making her life difficult, like does she think her memory is not as good as it used to be, and you need to also ask if she's eating well and cooking for herself without difficulty or not. Stress that you know her son cares for her and would want to be informed her present situation. You need to stress that I know your son, he's very caring son and he's very concerned about you, and that's why he needs to be informed regarding your present situation. So you need to persuade him. You need to just convince her. Ask her permission to phone him so that he can help with finding a solution to make her life easier. So you can just say, okay, what I can do for you is, I'll just call him in the evening, or whenever he gets free, I'll just call him and then discuss these problems with him. If she'll say, no, I don't want him to be worried about my problems, then you need to convince her that kindly, if you allow me, I can just call him so that he should also know about his mother's condition, like this. So these are the things that you need to discuss with the patient. So very clear. So like in this role play, you can start like this. Hello, Miss Maria, how are you doing? Seen after a long time. How's your son? How are you doing? Then patient will say, I'm fine, I'm all right. Then you can say, I can sense there is something wrong, or you seem to be worried. What happened? What's bothering you? You can ask this reason like this. So this introduction is a very good introduction, and even this is a good way to initiate the role play, because it is indicating that you know her already and you are very friendly with her. So, and also, like if she's not asking directly anything, if she's not asking anything directly, you can just ask like something is, I can sense there is something wrong, or you are worried, what seems to be bothering you. Then she can start her conversation that I'm getting old and my memory is like this, I'm not happy and all. Then you just listen to her very carefully. Then you can say, okay, so you mean to say that the people, those who are caring for you, they are, not behaving properly with you. They are hiding some things from you or not taking proper care of you. Am I right? Then she will say, yes, you're right. It's making my life difficult and all. Then you can ask about her health. What about your health? Are you doing well? Are you eating well? And what about your food? And then you can ask, Is there anything that you felt, anytime you felt that there is some memory loss, or you're not able to, like, you can, don't use this word memory loss, you can say you're not able to memorize the things, then you can say, yes, this happens. Like, I just forget the things and my daily life. Okay, then you can say this happens generally in old age. So don't worry about it. Nothing is wrong with you. Everything is all right. Maybe you are missing your son. So why don't you visit him, or you can ask him to come and stay here for 3 to 4 days, spend time with you. Like, you can just give her ways how she can improve her life and think positive. Then you need to stress that your son is very caring, you need to stress like these things, that he is very caring. And have you talked with him or not? Then she'll say, no, I haven't talked with him, because I don't want him to bother, because he's working there, he has his new job there and all. Then you say, okay, I can understand you concerning a mother, you are thinking for your son, but he is very caring and he cares for you. He has hired some people for you. So he should be aware about your present situation. You need to convince her to inform her son about her problems. So in the end, she'll be convinced, and you'll take your son's recent phone number, his availability timings, and then you can ask her that I'll call him, or if he's free now, or can I call him now? Or is there any other availability time? You can take the timings and call him, and that's it. And this is how you can say, and then you can say that I'll visit you after I call your son, and don't worry, I'll visit your house, and I'll just see like if there is wrong with you or not, or I'll just ask your son to visit you. Okay, so do you have any other issues? Or simple, you can say, are you all right? Can you go home, or shall I send someone or somebody, or is there anyone waiting for you outside? Like this. So this is how you have to perform this role play. So your tone, your language, the way you speak really matters a lot. So now sometimes you won't be speaking directly to a patient. What you'll be doing is you'll be speaking to the carer of a patient or the parent of a patient. So I'll discuss the role play like that in my next video. So until then, just watch this video, and in the next video, I'll be coming up with that case in which you were not talking to the patient directly and you're talking to the patient's carer or the parent of a patient. So stay tuned and wait for the next video. So I'll come up with the next video with this topic. Until then, just keep on practicing the role plays and also keep on watching the videos, and all the best for your role play, all the best for your exam. If you want to avail our offline as well as our online classes, you can contact us on the number given below, and you can avail our OET courses for nurses as well as for doctors. So goodbye, take care.